Did you know that handful of nuts you munch on every day, thinking you're doing your health a huge favor, might actually be speeding up your brain's aging process? Sounds scary, doesn't it? But it's the stark reality that many experts are now uncovering. Just imagine. You religiously follow all the nutritional recommendations you've learned throughout your life. You avoid sugar, take your meds like clockwork, include those natural nuts in your breakfast. What if I told you that these very nuts could be sabotaging all your efforts to maintain good health? An alarming study published in the respected Journal of the American College of Cardiology revealed something few suspected. Certain types of nuts, when consumed regularly, can increase the risk of developing heart disease by up to 48% after the age of 60. And we're talking about those common nuts sold in bulk at grocery stores or even recommended in the trendy low-carb diets. Some of these nuts are ticking time bombs. They silently inflame your body, overload your kidneys and liver, interfere with the action of your daily medications, and even more worryingly, accelerate cognitive decline. And you know what's even more frightening? The worst of them might be in that homemade pesto you love so much, or simply stored in that seemingly harmless jar in your pantry. But don't despair, not all of them are villains. Today, I'm going to reveal not only the 4 most dangerous nuts for those over 60, but also the 4 nuts that every senior citizen should consume regularly to protect their heart, strengthen their bones, improve their memory, and even optimize their sleep. This is Dr. Alexander King, your ally on the journey to healthy and conscious aging. Before warning you about the dangers, I want to start with the good news. There are nuts that are true allies of longevity and should be part of your daily diet. Let's get to know them. Studies conducted by Oxford University have shown that older adults with adequate levels of selenium had a lower incidence of dementia and better performance on cognitive tests. In addition, this mineral works in partnership with vitamin E to combat oxidative stress in the brain, one of the main villains of neural aging. The result? Improved memory, more agile reasoning, and a lower risk of developing Alzheimer's disease. The recommendation is simple. Consume 2 Brazil nuts per day, preferably in the morning. They can be crushed and added to yogurt or a smoothie. But be careful, do not exceed this dose. In excess, selenium can be toxic. Have you noticed any cognitive improvement from consuming Brazil nuts regularly? If you haven't tried this routine yet, it would be interesting to start observing the effects. Walnuts? If there's a food that literally looks like the organ it protects, it's the walnut. Its resemblance to the human brain is no mere coincidence. Walnuts are very rich in omega-3 fatty acids, especially alpha-linolenic acid, ALA, which acts directly on cardiovascular health. A study conducted by the University of California followed older adults who consumed 30 grams of walnuts, approximately 7 units, 5 times a week, and found a 39% reduction in coronary heart disease. But the benefits go beyond that. Walnuts contain natural melatonin, the sleep hormone, helping to regulate the circadian cycle that often becomes dysregulated with aging. Therefore, if you suffer from insomnia, try eating 2 walnuts after dinner. It may be the natural solution you've been looking for. The resveratrol present in this nut is also a powerful anti-inflammatory, fighting the silent inflammation that accelerates aging and is behind almost all chronic diseases. Have you noticed any improvement in the quality of your sleep after consuming walnuts? What has been your experience with this food? Almonds. When we talk about bone health, almonds deserve a prominent place. Rich in calcium, magnesium, and phosphorus, they form a perfect trio to combat osteoporosis, a problem that affects 1 in 3 women and 1 in 5 men after the age of 65. A daily serving of 23 almonds, approximately 30 grams, provides about 75 milligallons of calcium, as well as vitamin D, which increases the absorption of this mineral. The result is greater bone density and a lower risk of fractures, which can be devastating in old age. In addition, almonds are excellent for cardiovascular health. A study published in the Journal of Nutrition revealed that regular consumption of this nut can reduce LDL cholesterol, the bad one, by up to 12% in just 4 weeks. And it doesn't stop there. They also help control blood sugar levels, making them great allies for those with type 2 diabetes or prediabetes, extremely common conditions after age 60. To take advantage of all these benefits, soak the almonds in filtered water for 8 hours before consuming. This process, known as activation, neutralizes the phytic acid present in the skin, which can hinder the absorption of nutrients. Have you ever tried activated almonds? Have you noticed any difference in digestion or taste? Share your experience in the comments. Pistachios. Finally, we come to pistachios, one of the most underrated nuts when it comes to health in old age. This little green marvel is a champion in 2 essential nutrients for the aging brain, lutein and zeaxanthin. These 2 carotenoids cross the blood-brain barrier and accumulate in the region of the brain responsible for memory and learning. A study from the University of Illinois demonstrated that older adults with high levels of these compounds in their bodies showed neural responses similar to those of young adults in memory tests. In addition, pistachios are the nut with the highest amount of potassium, a fundamental mineral for vascular health and blood pressure. A 30-gram serving contains more potassium than a medium banana, helping to keep blood vessels flexible and reducing the risk of stroke. Pistachios are also rich in vitamin B6, essential for the production of neurotransmitters such as serotonin and dopamine, which regulate mood. It's no wonder that studies associate their regular consumption with the reduction of symptoms of anxiety and depression, problems that affect approximately 20% of the elderly population. The recommendation is to consume a 30-gram serving, about 49 pistachios, 3 times a week. Prefer unsalted ones to avoid excess sodium. Do you often include pistachios in your diet? Have you noticed any positive effects on your mood or memory after consuming them regularly? Now that we know our allies, it's time to talk about the dark side of the story. Some nuts, despite seeming healthy and even being beneficial for young people, can pose serious risks for those over 60. Let's get to know them. It's present in that nut mix you buy at the supermarket, in your salad dressing, and even in gourmet dishes. But for those over 60, it hides significant dangers. The main problem with cashews is their high oxalate content, compounds that, in excess, can form crystals in the kidneys. A study conducted by Harvard University followed 3,000 older adults for a decade and found that those who consumed cashews 5 or more times a week were 67% more likely to develop kidney stones. In addition, oxalates bind to calcium in the intestine, impairing its absorption. For those who are already struggling with osteoporosis or have low bone density, extremely common conditions after 60, this can mean a worsening of the condition. Even more worrying is the interaction of cashews with common medications in old age. They contain compounds that can interfere with the action of anticoagulants like warfarin, making them less effective and increasing the risk of blood clots. I remember the case of Mr. Smith, a 72-year-old patient who had been perfectly controlling his atrial fibrillation with anticoagulants. After starting to consume a nut mix, rich in cashews daily, his test results started to become irregular, and he ended up suffering a minor stroke. Only later did we discover that the culprit was the innocent cashew. Do you consume cashews regularly? Have you noticed any changes in your kidney tests or in the effectiveness of your medications? Macadamia nuts. In second place, we have the noble and expensive macadamia nut. Considered a gourmet delight, it has been gaining space in ketogenic and low-carb diets due to its high content of healthy fats. However, for older adults, macadamia hides a particular risk. It is extremely rich in manganese, providing more than 200% of the recommended daily intake in just a 30-gram serving. Although this mineral is essential in small quantities, excess can be neurotoxic, especially for brains already weakened by aging. Recent studies published in the Journal of Neurochemistry have associated high levels of manganese with the development and progression of neurodegenerative diseases like Parkinson's. The symptoms of manganese toxicity can be easily confused with dementia, mental confusion, motor coordination problems, and mood changes. Another serious problem with macadamia is its potential to cause taste loss in older adults. This happens because it contains compounds that can interact with taste receptors already naturally reduced by aging. As a result, many older adults who consume macadamia regularly begin to find food tasteless and end up adding more salt to their food, which aggravates high blood pressure problems. Taste loss, in turn, can lead to silent malnutrition, a serious problem that affects 1 in 4 older adults living at home and up to 50% of those living in assisted living facilities. Have you noticed any changes in your perception of flavors after consuming macadamia? Share your experience. Peanuts. Surprised to see peanuts on this list? Well, although it is technically a legume and not a nut, peanuts are commonly grouped with nuts and consumed in the same way. The big problem with peanuts for older adults is related to their high susceptibility to contamination by aflatoxins, substances produced by fungi that grow naturally in this food. Aflatoxins are potent carcinogens and have been associated with the development of liver cancer. With aging, our immune and detoxification system becomes less efficient, making it much more difficult for the body to eliminate these toxins. A study published in the International Journal of Cancer demonstrated that people over 65 who consumed contaminated peanuts had a 78% higher risk of developing serious liver problems compared to non-consumers. In addition, peanuts are highly allergenic. Although many people associate food allergies only with childhood, the truth is that they can develop at any age. An alarming phenomenon observed in recent years is the emergence of peanut allergies in older adults who have consumed them without problems throughout their lives. The symptoms of these late allergies are often confused with other conditions. Intense abdominal pain, swelling, mild shortness of breath, and skin rashes can be mistakenly diagnosed as common digestive problems, asthma, or simply dry skin related to age. Have you felt any digestive discomfort after consuming peanuts? Have you noticed skin spots that appear and disappear for no apparent reason? Pine nuts. Last but not least, we have pine nuts, that delicious seed that's used in many cuisines. Although nutritious, pine nuts pose a particular risk for older adults with diabetes or prediabetes, conditions that affect more than 30% of people over 65. This is because they have one of the highest glycemic indexes among all nuts and seeds, causing blood sugar spikes that can disrupt already stabilized conditions. A study conducted by a local university followed older diabetic adults who consumed pine nuts regularly during the season and found that 68% of them experienced significant glycemic dysregulation, with some cases requiring medication adjustments. In addition, pine nuts contain a considerable amount of tannins, compounds that, although they have antioxidant properties, also interfere with the absorption of iron and zinc. Deficiency of these minerals is a serious problem in old age and can cause anemia, immune compromise, and even cognitive changes. Another worrying aspect is their interaction with medications for hypertension. Thiazide diuretics, commonly prescribed for older adults with hypertension, already increase potassium excretion. When combined with the high tannin content of pine nuts, they can lead to dangerous conditions of hypokalemia, low potassium levels, manifesting as muscle weakness, mental confusion, and cardiac arrhythmias. Have you noticed changes in your blood sugar levels after consuming pine nuts? If you take blood pressure medication, have you experienced symptoms like muscle weakness or dizziness after eating this food? Now that you know both the allies and the enemies, let's talk about how to incorporate the beneficial nuts into your routine safely and effectively. After all, it's not enough to know which ones to consume. You need to know how, when, and in what quantity. Proper preparation. Activation. The first secret to maximizing the benefits of nuts is the activation process. All nuts naturally contain enzyme inhibitors and phytic acid, substances that hinder digestion and nutrient absorption. This is a defense mechanism of nature itself to protect the seeds until they find ideal conditions to germinate. The activation process is simple. Soak the nuts in filtered water with a pinch of sea salt for 8 to 12 hours. Then drain and dry them in a low oven, not exceeding 150 degrees Celsius, to preserve nutrients for about 12 hours or until they are crunchy. This process simulates the natural conditions that would activate germination, neutralizing the anti-nutrients. For older adults whose digestive system is no longer as efficient, this preparation makes all the difference in nutrient absorption and in preventing digestive discomfort. My patient Mrs. Johnson, 83, suffered from gas and abdominal bloating after eating nuts. After she started activating them, the symptoms disappeared completely. Have you ever tried activating your nuts? Have you noticed any difference in digestion or even in taste? Ideal times for consumption. The time of consumption of nuts can enhance their specific benefits. Limit yourself to 2 units per day to avoid excess selenium. Walnuts. Perfect for the late afternoon or early evening between 6 p.m. and 8 p.m., when they can help regulate the production of natural melatonin. A serving of 30-degree 3 times a week is sufficient. Almonds. Best consumed as an afternoon snack between 3 p.m. and 5 p.m. to keep energy levels stable and avoid that glucose drop that can compromise cognition. A serving of 30-degree on alternate days is ideal. Pistachios. Excellent for consumption after lunch, helping to control the post-meal glycemic peak. A 30-degree serving 3 times a week brings the desired benefits without overdoing the calories. Enhancing combinations. Certain combinations can maximize the absorption of nutrients present in nuts. Walnuts plus dark green leafy vegetables. The phytochemicals present in spinach, arugula, and kale enhance the anti-inflammatory action of walnuts. A salad with green leaves and chopped walnuts at dinner is an excellent choice. Almonds plus plain yogurt. The calcium in almonds is better absorbed in the presence of the proteins and probiotics in yogurt. An afternoon snack with plain yogurt and activated almonds strengthens bones and improves intestinal health simultaneously. Pistachios plus extra virgin olive oil. The carotenoids in pistachios are fat-soluble, meaning they need fat to be absorbed. A salad drizzled with quality olive oil and pistachios is a powerful neuroprotective combination. Have you tried any of these combinations? What has been your favorite? Proper conservation. A final fundamental aspect to ensure the safety and benefits of nuts is the way to store them. Due to the high oil content, they are very susceptible to oxidation, which not only alters the flavor, making them rancid, but also transforms healthy fats into potentially harmful compounds. The ideal is to store nuts in airtight containers, protected from light and heat. For longer periods, the freezer is the best option. Nuts can be frozen for up to 12 months without significant loss of nutrients. Avoid buying large quantities at once unless you intend to freeze them. A practical tip is to buy nuts with shells whenever possible. They stay fresh for much longer, as the shell is a natural protection against oxidation. Do you usually pay attention to how you store your nuts? Have you ever had the experience of consuming rancid nuts without realizing it? Throughout my years of clinical practice, I have witnessed true transformations in the health of older patients simply through adjustments in their diet, especially with regard to the consumption of nuts. I would like to share some of these inspiring stories with you. Mr. Peterson and the reversal of cognitive decline. Mr. Peterson, 76, came to my office accompanied by his daughter, visibly concerned. In recent months, he had been experiencing significant memory loss, difficulty finding words, and an onset of spatial disorientation. They had already consulted neurologists who suggested an initial picture of dementia. When analyzing his diet, I discovered that he consumed a daily mix of nuts that mainly contained macadamia and cashews, precisely our 2 main villains, We replace this mix with a strategic combination: 2 Brazil nuts in the morning and a small portion of pistachios in the afternoon. In just 3 months, the results were surprising. His score on the mini mental state examination, a standardized cognition test, rose from 21 to 26 points, moving from the impairment range to normality. The daughter, moved, reported that her father had returned to reading newspapers, playing chess, and actively participating in family conversations. Of course, we cannot attribute all the improvement only to nuts, but Mr. Peterson's levels of selenium and carotenoids, which were far below ideal in the initial tests, normalized completely with the new diet. Mrs. Davis and the liberation from pain. Mrs. Davis, 68, suffered from intense joint pain that limited her daily activities. She had already tried several anti-inflammatories, physical therapy, and even acupuncture with modest results. When investigating her diet, I discovered that she loved peanuts and consumed them practically every day, in the form of peanut butter cups, peanut butter, and even in the form of peanut brittle. Interestingly, her exams showed consistently elevated inflammatory markers. I explained to her about the risks of peanuts for people over 60 and suggested replacing them with walnuts and activated almonds. We also included anti-inflammatory foods in her diet like turmeric, ginger, and berries. In just 6 weeks, Mrs. Davis reported a reduction of about 70% in her pain. Her inflammatory markers also fell significantly, and she was able to reduce the dose of her medications under medical supervision. Today, 2 years later, she walks 3 miles daily and has returned to dancing at senior centers, an activity she had abandoned due to the pain. The most impressive thing in this case was that simply replacing one type of nut with others more suitable for her age made a tremendous difference in her quality of life. Mr. Anderson and glycemic control. Mr. Anderson, 72, a type 2 diabetic for over 15 years, had been struggling to control his blood sugar despite correctly following his medication regimen. During the consultation, he mentioned his love for pine nuts. He lived in a northern state and, during the season, would consume pine nuts daily. I explained to him about the high glycemic index of pine nuts and suggested replacing them with pistachios, which have the opposite effect. They help stabilize blood sugar levels. I also recommended a small portion of almonds before main meals, a strategy that has been shown to be effective in reducing the post-meal glycemic peak. After 3 months following these recommendations, his HbA1c, a marker of long-term glycemic control, fell from 8.2% to 6.9%, much closer to the therapeutic target. His endocrinologist was impressed with the improvement and was able to reduce the dose of one of his medications. Do you know anyone who has undergone a health transformation after adjusting their consumption of nuts? Or perhaps you yourself have a story to share. We have reached the end of our journey through the fascinating world of nuts and their effects on the body after age 60. As we have seen, something seemingly as simple as choosing the right type of nut to consume can make a monumental difference in your health and quality of life. Let's recap the main points we covered today. Next, we identified the 4 potentially dangerous nuts after age 60. Cashews, which can form crystals in the kidneys and interfere with common medications. Macadamia nuts, with their excess manganese that can be neurotoxic. Peanuts, which are not technically a nut but are consumed as such, susceptible to contamination by aflatoxins. And pine nuts, which can disrupt blood sugar and negatively interact with medications for hypertension. We also learned about the correct ways to prepare, consume, and store beneficial nuts to maximize their positive effects, the activation process, the best times of day for consumption, the enhancing combinations, and the proper storage techniques. Finally, I shared real stories of patients who transformed their health through simple adjustments to their diet, demonstrating the power that small changes can have when they are based on solid scientific knowledge. Always remember, aging is a privilege, but aging with health, lucidity, and autonomy is an achievement that depends on the choices we make daily. And often the difference between a body that gets sick and a body that flourishes in old age lies in something as simple as the next handful of nuts you put in your mouth. My invitation now is for you to start implementing this knowledge in your life. Start gradually replacing potentially harmful nuts with beneficial ones. Observe how your body responds. Pay attention to subtle changes in your energy, mental clarity, digestion, and overall well-being. And of course, don't keep this knowledge to yourself. Share this video with your friends and family, especially those who are already over 60 or are approaching that age. Knowledge only has value when it is shared and put into practice. If you enjoyed this content and want to continue learning about how to take care of your health naturally and effectively in maturity, don't forget to subscribe to the channel and turn on notifications. Every week I bring valuable information like these, always based on the latest science and my clinical experience of over 30 years. And remember our saying, true youth is not in the absence of wrinkles, but in the presence of vitality. Take care of yourself today to reap the rewards of a healthy old age tomorrow. Leave in the comments which of these nuts you consume the most, and if you have noticed any of the effects I mentioned today. Your experience can help other members of this community. This is Dr. Alexander King, reminding you that small dietary choices can make big differences in your health. Until the next video.